would just start by saying that Whittier is a very special place.
Places like Whittier Street Health Center, are the embodiment of providing, top quality, exceptional care at a level where people can find it most accessible. And that's why, I keep referring to it as a model, not only in Boston, but beyond.
I've been involved with Whittier for a number of years as a supporter. I've been involved in philanthropic activities where we provided grants to Whittier, and they always perform so well.
I've always been interested in the delivery of healthcare. And some of the other, I think I bumped into Frederica. And, once you bump into Frederica, it's pretty hard not to get involved with Whittier.
We have a lot of work we do on disparities in cancer outcomes among disadvantaged communities. And the Whittier Street Health Center seemed like a great place where we might try to do something creative.
Whittier Street Health Center is a wonderful healthcare delivery organization, creating partnerships with 3 academic medical centers, the Brigham and Women's Hospital, Boston Medical Center, and Dana-Farber Cancer Institute, focused on having the very best people providing care to the people of that community.
We decided, working with Frederica, to develop a clinic where we actually embedded oncologists with the primary care physicians and other specialists who work at Whittier Street so that we could begin to learn what it is that patients see as barriers to coming to a place like Dana-Farber to get cancer care. So that's how it all got started.
One of the things that's really distinctive about Whittier is the very conscious effort they're making to integrate medicine with public health. That we are spending way too much money on medical care and we're investing far too little in public health where whole populations health can be improved. I think Whittier is really out in the vanguard in pioneering ways to integrate the perspectives and the tools of medicine and public health to get a better result.
Everybody in the city of Boston, if you live or work here, has some hint of what Whittier Street is all about.
It's a huge honor to be called the champion of equitable health care. I think it means that whenever you get a chance to influence people's thinking about their priorities and influence people's thinking about bringing everybody up the success curve, doesn't it start with health?
It's almost become a rite of passage as a business leader in Boston to be roasted by the Whittier Health Center.
Just to go visual here for a second, are these posters that they do every year of the recipients. And I have a blow-up of this at home, and it's really a treat.
2 friends of mine came and talked to me and persuaded me that I ought to be the roastee for that year. So that was 9 years ago, and we had a great time. It was a fun-filled evening.
Being roasted is an interesting experience. You never know what people are going to say about you.
I chose to try to give back a little bit to the audience by entering the room as James Brown, complete with long black cape and James Brown music.
My biggest mistake was picking my son to roast me.
I think I have the distinction of I may be the only roastee who had a poem written for him.
When it was all finished and Tim and I had a chance to give each other a big hug, I said that we were going to have to end the proceedings early so I could go home and write Tim out of my will.
I think the most fun moment for me was actually the entrance onto the floor where the band is playing a special song that we chose together, and for my kids to see all that attention on me, it was really a special moment.
I've been a patient here since 1975 when I was 13 years old. Whittier Street is like a home setting. You can get practically all the services that you need right here.
The whole question of equitable healthcare, maybe that's why I sort of feel so strongly about Whittier. I believe very, very strongly the most important thing is access.
I really view healthcare as a social justice issue and a civil rights issue. That Martin Luther King said one of the most important rights of all is the right for healthcare.
My addiction took me to where I was living under a bridge. I didn't think I was going to live. If you've seen a picture of me, it was like really bad. I went through a lot getting my son back through Department of Children and Families, and they told me at one point that I would never see my son, and they took him away due to my addiction, and that's why I come to Whittier Street. My son's my world today, and I owe it to Whittier Street Health Center because They've turned me around.
In the shadow of magnificent academic medical centers, birth outcomes for the babies born to women of underrepresented minorities, particularly African American babies, are at much higher risk than those born to white mothers. That's unacceptable.
You know, I was sick a lot, and I had been having a hard time with depression and stress. You know, the level of support that I've gotten over the years has been tremendous.
We can focus on the responsibility we all have to take care of ourselves, to exercise, to eat the right things, and that's a big part of staying healthy, as well as having access to medical care when you need it.
Patients have to play a role, and the more proactive patients are, the better the outcome. I mean, it's just a plus. That's one of the things that I really feel at this place.
I first came to Whittier when I was 3 years old. I'm now a senior in high school. I'll be going off to college to study computer sciences. Whittier has instilled in me a foundation of holistic health and wellness. As an African American male, there are things in my health I need to take into consideration. I have a family history of obesity, diabetes, and high blood pressure. Also, the men in my family have a history of not living past 70s, and I hope to break this cycle. I've made a point to be more physically active by going to the gym. I've also made more healthy choices when it comes to food. So when I go to college, I can tackle a freshman 15.
So I think of the payoff of having your child's health taken care of properly. The healthcare statistics in the US are bad because of not so much healthcare as public health. And public health means behavioral, and a place like Whittier doesn't just provide the medical care, it provides healthcare, which is just totally a broader concept.
I come here to see the doctor, but I love most is the cooking class and the Christmas party.
To come into a place where you see the mix of ages, you see the mix of ethnic backgrounds, you know, to see all of this activity go on and know that it's toward better health in the community and just general well-being.
Well, the reason why I came here was because of HIV. I'm HIV positive, and I've been HIV positive since 2003. Whittier cares. They care about their patients, and that's why I love Whittier.
They do so much for the community, and to have Whittier call me a champion when they're really the champions, it's a very special feeling.
And everybody, by working together, has made sure that this center is going to be equitably standing on its feet and doing the job that it needs to do for an entire community and for an entire city.
To be called a champion is unearned, unwanted. It is the people who work in Whittier day to day are the champions. I'm not a champion.
Whittier is an ambitious institution, I think, in the best sense, and the building that they succeeded in financing and getting built, it's an extraordinary statement, really. There are people who care about you. There are first-class institutions here to serve you.
The reason for the success, I think, is multi-layered. First of all, the leadership. Frederica and her team are well known in the community, and they have the confidence of the community.
She has helped this organization grow and adapt as the needs of the patients have changed. She's someone who has such a sense of vision for the future, and she has built such a strong both clinical and administrative team at the center that it really starts with leadership, and they really have it all.
Frederica, we love you. Thanks for laughing at me 9 years ago. But those laughs were really worthwhile. I hope everybody had a good time then. I know they're having a good time tonight, and it only grows better this year, next year, and the years beyond.